Hi everybody, it's Traci from Downwarddogrising. Tonight I'm going to bring shoulder work to you. So if you've ever had frozen shoulder, or if you've had rotator cuff surgery and you're cleared for post-rehab workouts, you're cleared to start strengthening on your own, then this workout would be great for you. So let's first start with how to stabilize our shoulder girdle, how to keep our arm bone deep down into the shoulder socket, and how to know if we're doing something correctly. So join me and let's begin. First, I want you to lie on your back, and I'm just going to have you one time only. Most people do not realize when they tell you pinch your shoulder blades together, squeeze your blades together, and work your middle back. That's incorrect. If you do that, you're compressing all the space in there and everything in between. That's not how you properly stabilize your shoulder girdle. And let's do one time where we squeeze and pinch them together, and you're going to feel how unnecessarily squeezed together that is and compressed, and how it's unnecessary, because then I'll show you how to open them back up. And when you open them up, that's the state that you work from, when they're far wide apart and they're open. Let's do that right now. I'm going to face away, and I'm just going to ask you to pinch your shoulder blades. Squeeze them together. Here we go. Pinch, pinch, pinch. Squeeze those blades all the way in. And it's uncomfortable, it hurts, and it's unnecessary. Now, start to widen. Create space. Open them apart. Do whatever you need to do. Open them wide. Now, there's space, the upper mid-back is wider. So now we're going to work, pull your elbows apart, stretch one arm up only as high as the head of the shoulder stays down, the head of the humerus, your arm bone doesn't do that when you lift. Avoid that, blades down, avoid this, open wide, force couple as the mechanism on your shoulder joint. The muscles in the front, your collarbones widen. We feel like an openness across the chest, and our blades just float down the back. We avoid pinching and we avoid squeezing. Elbows wide, track those arms right above the shoulder socket. 5, tops of shoulders away from ears. 4, and 3, we want scapular stability. 2, and last one. All right, so when you do that, we only have to pinch them together once to feel how icky it feels. When you do that just once, you open them. Remember, if you're going to get on your mat, if you're going to do push-ups, if you're going to do wide to strengthen your pectorals, your chest muscles, if you're going to do narrow, if you're going to do tricep, Pilates push-ups, yoga push-ups to help you in Chaturanga Dandasana, all of those things, you're doing yourself an injustice if you pinch your blades together. If you squeeze them in, you're not doing yourself any favors. In the long run, you're going to have some shoulder issues later on down the road if you continue that way. So when you do a push-up, you should feel wide scapula across the back. The edges, the inside inferior spine edge of the scapula, they should not be pushed together. So they should be open. And then if you're doing a push-up on the floor, if you're the floor underneath me, I'd be doing this and my scapula would still be apart. They would not be hugging each other together. So just to know that is the mechanics that you want to use. So let's do something to free the space in there. We're going to lie on our back. Bear with me. Lie on your back. And then float your arms straight above your shoulder socket. And then basically you're pressing the back of your head and neck into the mat. Now that's your axial elongation of your cervical spine. Your neck lengthens. So then basically you lift the blades, the shoulder blades go away from your spine and they reconnect. And then that makes some room in our thoracic spine. Let's do 6. Lift up, come back, and 5, and 4. Lift and down, and 3. Make room in there, 2. Last one. Okay, when we get tight, our shoulders hike into our ears, and they internally rotate. Okay, so what do we do to go against that, to recorrect it? We have to use the natural bone rhythm of how our bones go deep into our sockets. What are we going to do? We're going to reverse the internal rotation. So you lift up, protract, externally rotate, come back to neutral, pull the blades down, retract. Up and out, in, back, down, up, out, in, down. Get that humeral bone, that's the top bone of your arm here, to go deeper down into your shoulder socket, your shoulder joint, the glenoid fossa. 4 more, up and out, in, down. Screw in the light bulb. 2 more, up, out, in, down. Last one. Okay, now here comes rotating arms. You're going to look at the palm that's up in the air. You're going to press the palm against the mat on the other side. If your arms do not lift to the height of your shoulders or slightly lower without pain, well then you'd go down here or anywhere where there's no pain. Avoid pain. Simple. Avoid pain. All right. Press your palm against the mat. Inhale. Feel that left collarbone open wide. Now peel up as you look at the palm that's up. Get this whole side to open and stretch side of neck. Come back in. Now take this palm, push it down, lift this palm up, peel up and stretch. Come back, rotating arms. Pretend someone's pulling. Inhale, stretch, come back. Someone's pulling. Press that palm down. Inhale, stretch, come back. Exhale, let's do 4. Stretch that scapula in the back. Stretch your collarbone in front. 3. Rotate those arm bones deeper into your shoulder socket. 2 more. Inhale. Exhale. Last one. Inhale. Exhale. All right. Good job. Next, what are we going to do? We're just going to get the head to release at the base of your skull. Nose, chin nods. Nose up, nose down. You don't have to lift your head off the mat. Chin up, chin down. Nod yes. Release at base of skull. Tiny nose circles now. Go into your second vertebra in the neck. Baby circles. Breathing in, breathing out. Breathing in, breathing out. Reverse, opposite direction. Just free up some space. Decompress your cervical spine, your neck. All right. Now we're going to decompress. We decompressed your neck. We decompressed your thoracic spine. Here comes your lumbar spine. Your abdominals, whether you're male or female, draw your abdominal wall in deeply, all the way from pubic bone towards navel. Pull in, zip up, and roll your pelvis back. Use those deep abdominals to shift the pelvis. Roll forward. And then if you have any issues in your back, then stop before pain begins. Either direction. Avoid pain. Simple. Move and stop when there's pain. Avoid it. Breathe in. Exhale. Roll back. Scoop really tight. 3 more. Get that low back to decompress. 2 more. And last one. Awesome. Okay. Now maybe you'll turn to your side. In case you have any low back issues, turn to your side to come up. And we're going to come on to all 4s. Okay, next. Again, avoid. We'll do shoulder shrugs so you see what to do. Let's release tension out of the shoulders. So actually, for the only time during this workout, I'm going to tell you to shrug shoulders to ears. So the rest of the workout, I'm going to say, get those shoulders out of your ears. So here, shrug up. Inhale, now release the tension through the arms, through the fingertips. Exhale, release. you're gonna work on getting the sides of your neck to lengthen. So you're gonna go, inhale now, exhale, release, inhale, exhale, release, inhale, and then you're gonna exhale, release. 3 more, shrug up. Only time I'm gonna tell you to let those shoulders go into your ears. 2 more, release the tension through those fingers. 1 more, exhale. Now, I'm going to stretch this arm along your side. Anchor point, I want you to feel the collarbone open, neck long, and just tilt. Stretch out this whole side over here and breathe. Lengthen the whole side of your neck. We get really tense of our shoulders if we live in a chronically hiked up shoulder position. Your neck is going to be tight. Come back center. Now, this hand slides in, this hand slides out. That's your anchor point. Create length inside of neck and slowly just stretch away from that anchor point. Stay here and breathe. Create that length. 1 more deep inhale, stretch the side of your neck. Exhale, release. Okay, now, we're gonna go onto all fours. Of course, you wouldn't do all fours if you have any knee issues, knee replacements, you're not gonna kneel. And then if you have any meniscus issues, you're not gonna kneel. What you could do instead is do this. You would float your arm to shoulder height as your blade anchors to the back of your pelvis. You would float your arm to shoulder height as blade anchors to back of pelvis. Avoid this. Avoid this. Someone with frozen shoulder goes to lift up their arm and it's just like stuck as one thing. That's what's frozen. So you've got to get it to separate. So now you're either going to sit like this or you're going to come onto all fours. When you're on all fours, you're in neutral position, so front ribs meet back ribs. Basically, you want to feel shoulders are down, away from ears, sides of neck long. And then you want to just float your arm up to shoulder height, pull the blade down to the back of your pelvis, other side. Float your hand to shoulder height, float the blade back down. 4, blade to back pocket, shoulder out of ear. 3, the 2 sides might feel different even. Blade to back pocket, 2 more, shoulder out of ear. Inhale, exhale, last one. Okay, now I would suggest 2-pound weights or 3-pound weights so you don't overdo it. And then I don't have 2 or 3-pound weights, I have 5 or 10 pound. Definitely don't want to do 10 pound, that's for darn sure. But if you have 5 pound, maybe you can do it, I don't know. I wouldn't recommend it. Do 2 or 3, especially if you're coming back from a surgery. But here's a 5 pound. We're just going to do 5 reps. Scoop your core tight, blade down your back, and you just float your arms straight up to shoulder height. If there's pain, then that means you stop before you make it to shoulder height. 4, blade to back pocket, come back in. 3, blade to back pocket, your scapula are wide across the back. 2, blade to back pocket. Last one, blade to back pocket. Switch arms. So you keep the length, core tightens to low back. When I say blade to back pocket, it's because you don't want to hike up. Anchor the shoulder blade, tighten abdominal wall to back, space on sides of neck. Inhale. Now, exhale. Inhale. Exhale. Good job. 3 more. The shoulder blade aims down the side of your back. 2 more. Last one. Exhale. Come back in. Okay, that's one direction. And then when your arm bone travels forward like this, you want to feel how when you anchor the blade in the back, it drops that humerus bone deeper into your socket. So we're going to continue with a side raise. So your abdominals tighten in, Low back is neutral. Low back has length. So now you're going to lift your arms straight out to the side. Tighten your core to your back. Lift just to the height of your shoulder. Come in. Exhale. Come in. Exhale. Come in. Exhale. Come in. We're just going to do 5. And then this is just a parameter to set up. You can play this and then you can pause it. And then you could do 10 reps. And then you could do 2 sets of 10 reps. You can go up to 3 sets of 10 reps. Whatever you feel like doing. Blades to back pockets. Neck is long. Lift for 5. Shoulders out of ears. Lift for 4. 3. Your core is strong. And 2. Exhale. Inhale. Last one. Exhale. Inhale. Okay, next. I want you to feel the head of the humerus bone. That's your entire arm bone from here to here. Now from here to your wrist, that's going to be your ulnar, wait a minute, ulnar radius. I'm trying to it's been a while, I know. I keep thinking of the lower leg bones. It's your ulnar and radius, these 2 arm bones. So squeeze the upper arm bone, the humerus, into the side. Avoid going like that. Shoulder out of ear. Now I just want you to slowly extend the arm, slowly bend, and no, it has nothing to do with the top of the shoulder moving. You're isolating, you're squeezing your tricep. That's a tricep kickback, blade to back pocket. 2 more. And last one. Take it to the other side. Again, if you need to pause the video, do so. Do 3 sets of 10. Shoulder out of ear, both sides, shoulder out of ear, tighten core to spine, upper arm bone into your ribs, extend. Come in, extend. Come in, tighten your core, exhale. Inhale, exhale. Feel how your collarbones are wide. 2 more, exhale. Inhale, exhale. Last one, inhale. Reach and come back down. Awesome. So now you got to isolating that arm bone. Now let's do one more. Let's go ahead and do neutral hand grip. So, neutral. Whenever your thumb faces up and you do reaching with your arm, we call that neutral because of the way the arm turns in the socket. It has a better disposition to move and not hit the bony structure around it. So, let's do neutral grip, thumb up grip. And then let's just reach the entire arm all the way down to the side of your body like that. Straight back and in. Straight back. Shoulder out of ear and in. You're even going to feel your triceps, your lats, and your back. 3. Tighten your core to your spine. 2. Last one. Other arm. Shoulders down and back. Sides and neck long. Reach. Neutral grip and back. 4. And back, deep exhale, stretch, and back, and 2, and back, last one, and back. Okay, so now you went that direction. Next, what I want you to do, we're going to sit facing forward, and then we're going to have you reach to the sides. Then we're going to do something lying on your side. Again, there's width across collarbones, shoulders are out of ears. You're on each of your sits bones. Now, you're going to lift and down. And you don't want to feel like you're pushing. You want to feel like your blades float down your back. Your chest is open. Your neck is long. Breastbone to sky. And you're going to elevate those arms to the height of your shoulders. And then you're going to lower down, head to sky, head away from tailbone. Elevate to height of shoulders, and then you're going to lower down. Elevate and lower. Then you're going to elevate and lower. 2 more. Sides of neck are long, tops of shoulders are down and back. 1 more. Elevate and lower. Okay, now hold anywhere in an increment of 5 to 10 seconds. Hold. 5, 4, 3, 2, lower down. Maybe 10 seconds. 5, 4, 3, 2, and lower down. Good job. Okay, Next, we're going to take neutral grip, thumbs up, sides and neck are long, blades pull to back pockets. You're going to reach your arms over your head. Say you need extra rest time, instead of doing both at once. And notice I'm not throwing the arm, I'm not locking the elbow, I'm going straight above my shoulder socket. Exhale, sides and neck are long, tight the core to spine. Exhale, inhale, sides and neck are long, I'm controlling. Straight up, straight down, straight up, straight down. The top of that shoulder is away from the ear. Top of that shoulder is staying down, up, down, up, down. I have less stability in my left shoulder. I can feel it. I can see my range is different too. It elevates a little. 2 more. Up and down, up and down. Good. Okay, next. I want to do something lying on your side. There's a little series we do in Pilates on the reformer, and we could do like a light spring on a blue. If you have an injured shoulder, you'd maybe go to the very, very super light spring yellow. And once you get going and you're feeling strong, you could even do it on a red spring later on. So now we're going to lie on our side and just maybe keep your knees bent 90 degrees in line with your hips. Lie down on your mat, relax your arm. Maybe you'll bend, maybe you'll extend, maybe you put your head on a yoga block, whatever feels good to you. And you just feel like the sides of your waist stretch long. So we never go higher than our shoulder height. So say you have your 2-pounder, your 3-pounder, you're gonna go to the height of your shoulder. This is what happens when the head of the humerus pops. It just elevates and it feels uncomfortable and it starts to have pain because you're not supported. So it has to pull down and back, and then you just stretch the arm down. I'm just going to do 5. You could pause the video, do 5 more, 4, or you could just run through the whole thing 3 times if you like. Something like that. 3. Shoulders out of ear, collarbone widens across chest. 2. And 1 more time. Reach. Okay, now take it down to the height of your hip. Now you'd slowly swing to shoulder height in front. Keep the shoulder out of your ear. To the front. Keep shoulder out of ear. And 3. Coming back. And 2. Coming back. Okay, last one. Coming back. Okay, now do a little bicep. Little bicep, reverse bicep, getting to your tricep. So you just hug that humerus bone into your ribs. 3. Exhale. 2. Shoulders out of ears. Last one. Awesome. All right. So you just did that side. Shake out your arm. Wonderful. Okay, we're going to do a little stretch for your thoracic spine before we switch sides. Maybe you need a pillow. Maybe you need a yoga block under your neck. You take your palms together and bottom shoulders out of the ear so you don't scrunch it. You would just open, open, open. Avoid this if you have scoliosis. I'm not going to have you do a big twist. Neither would I have you do a huge twist if you have your osteoporosis. You would do a smaller motion, a little twist like collarbones wide. Come in, breathing in. And exhale. Your hip bones are forward. We're getting into your thoracic spine for mobility. 3. We need mobility in the middle of our back. Chest is open. And 2. Excellent. 1 more. Awesome. And then if you had hardware holding your spine together, you definitely don't twist. So just know that. If you know, oh gosh, I have rods in my spine, well then definitely you don't twist. So now we're going to switch sides. We're going to come around to the other side. Make that 90-degree angle with your legs. And then we start again. We're going to do our top arm. And we're going to start doing our arm lifts just to the height of the shoulder, no higher. So then, let's begin. My hair, I just had to fix it. Okay, now, you're on your side. Your shoulders are out of your ears. And I know that my left side is weaker. And then I can tell that I have less stability in my left shoulder blade than in my right. So I'm a good pupil for this one. So the first one, we had our hand at our hip. And then my hips are a little off too. And I have a little rotation in my spine. Okay, I'm a good one for this one. I gotta pull my ribs in line. I gotta pull my shoulder back. Keep my neck long. Now we're gonna go straight up in line with our shoulder socket. Create space. Make sure your shoulder doesn't hike. Inhale, and then you're gonna exhale. You're gonna inhale, and then you're gonna exhale, making sure the top of the shoulder stays down. And 3. Abdominals pull in tight. And 2. And last one, again, you could pause the video if you want to do more reps. Second set, you're going to go shoulder away from ear. Careful not to collapse. Now you're going to float the arm forward and then keep the shoulder away from the ear. Float it forward, control from the back of the blade. Float it forward, control back down. Keep the head of the humerus bone. That shoulder is down away from the ear. 2 more. Shoulder out of ear, side of neck is long, side of waist is long. Last one. And you reach, and then you come in. Let's rotate our palm to the sky. Drop your shoulder out of your ear. Okay, now we're going to do like a little reverse bicep curl. We curl it in, we press it out, and we're going to actually get our bicep and our tricep. Good. Curl in, press back out. Top of arm bone stays glued into ribs. 2 more. And last one. Excellent. Okay, we're going to bring that arm down now. And then, let's see, did I do anything else on that side? I'm trying to remember. Yes, twist. So, if twisting isn't good for your spine, then avoid it. You're going to slide your arms together in front. Careful not to hike that shoulder. Again, avoid twisting if it's not good for you. You're going to open. Collarbones really open wide and apart. Stretch chest, stretch pectorals, open collarbones, and come back in. So you're going to inhale, and then you're going to exhale and come back. Inhale. You might have to modify your twist. Inhale, exhale. Good. 3 more. Breathing in, and come back. 2 more times. You're going to breathe in. Ribs expand. Breathe into those ribs. Come back. Last one. Inhale. And then exhale. Come back in. All right. So if you have scoliosis, you might just stay on your side. And you might try to just expand the bottom ribs into the mat. Expand the top ribs to the sky. Just lie there for a moment. And try to really stretch your intercostals, the muscles between the ribs. Try to open the ribs apart so you keep the length in the spine and you create some space in your back. So breathing in. Get everything to really open apart. Exhale, breathing in. Exhale. One more time. Get those ribs to really expand. Exhale. All right, we're going to do that on the other side just to make it uniform between the 2 sides. Again, you're going to come down, lie on that bottom arm, get those ribs to open apart, and then shoulders out of ears. And then you just want to feel like you could create length. There's like space under you. There's space along the sides of ribs. And then you just want to feel like you can really breathe and expand those ribs wide apart. Try to open up your rib cage. Expand into the ribs. Stretch those intercostals. 2 more. In case you have scoliosis, this will really help out. Breathing in. Feel how your whole bottom ribs expand and lengthen apart when you inhale and expand these ribs. Breathing in. Exhale. And gently release. Now press all the way up. And again, if you've had knee replacements or something, you're not going to kneel on your knees, of course. Maybe you would do something different. Sit in a chair, sit over a desk, sit over a bed with a chair, and just hip hinge from your pelvis over And then stretch your torso over the bed or over the desk, sitting in a chair, to get the same effect as like when you do rest pose, so you don't have to kneel. And just pull those sits bones back behind you. Create length by pulling your breastbone through the two arms. Create spaciousness. Lengthen apart. Breathing in and breathing out. Maybe you'll relax forehead into mat. Breathing in and breathing out. Sits bones reach behind you. Feel your entire spine stretch apart. Sits bones reach back. Breastbone pulls forward. And one more deep inhale here. And slowly walk your hands in. Press up to your hands and your knees. We're going to come into our Sukhasana. And then you don't have to do this next one if it's too much of a stretch for you. You can try it, and if it's uncomfortable, then discontinue. I'm going to give you a little yoga stretch now to end, to get in between your blades in your middle back and just to stretch out your shoulders and create deeper range of motion. But stop if you're not ready. Garudasana, otherwise known as eagle arms. So we're just going to crisscross. You have one arm on bottom, other arm on top. You relax shoulders both away from ears. Your palms come in. And you just slowly start to elevate the arms out in front of you to shoulder height. And breathe. Breathing in. And breathing out. Feel the scapula in the mid-back stretch. Inhale. And then exhale, release. Awesome. Head away from tailbone. Create lengthened spine. If this is too much, just back right out of it again. Inhale. And exhale. Good. And one more deep inhale. And exhale, release. Whatever arm is on the bottom, open, reverse it. So you crisscross, bring your palms towards one another, shoulders out of ears, slowly elevate the arms and breathe. Expand into sides and back of ribs, breathing in. And breathing out. Two more. Feel the stretch across the scapula, your upper middle back. And one more deep inhale here. Expand lateral ribs, breathing in. Softly exhale all the air out of your lungs and gently release. We're going to bring our arms down by our sides now. And we're just going to release the sides of our neck by doing a little head roll, neck roll. Avoid if you have any neck herniations or anything. Drop your chin. And you're just going to roll to one side. Again, we shouldn't have any pain with any of these things that we're doing. Stop if there's pain. And you just go back out of it. Inhale, soften. Exhale. Do a smaller range if necessary. Breathing in. Exhale. Inhale, two more. Side to side. Exhale. Last one. Breathing in. And exhale. All right. So this concludes our shoulder workout for tonight. So if you've suffered from frozen shoulder, rotator cuff tear, rotator cuff surgery, or you just don't have any range of motion, you have limited mobility in your shoulders, this is a great way to strengthen the right areas and work the right parts. So always remember this motion here. This is distal mobility. Control where my shoulders are down, back, out of ears. I can go up, I can go to the sides, I can come down with control. This isn't moving. So that distal mobility out here always requires proximal, that's close, that's tight to the body, proximal stability. That's your rotator cuff. That's your muscles, sits across, right across that upper mid back there, and all across where the shoulder blades sit on. And then our big latissimus dorsi, our lats go down the sides of our back. One of the biggest muscle in our upper body, those lats. So there's a lot going on back there. So it's important that we strengthen our serratus anterior at the top of those ribs here and here under the armpits. And then like things you could do would be like having like a ball under your palm, whether you're sitting up, you would push into 2 tennis balls and see if you can get the connection there, like push into the tennis balls. You could do the same thing lying on your back, press from the armpits to the palms, wake up that area so it goes across under those blades and just really connects and helps you access your lats even deeper. All right, this concludes our shoulder workout. Hope you enjoyed. Deep inhale, feeling thankful, feeling grateful. One more deep inhale, feel those collarbones widen, chest open. Thanks so much for supporting my channel. Appreciate you all so much. If you know anyone with shoulder issues, please share my video. I'd so appreciate it, and so would they. All right, good night, good day, good afternoon, whenever you find this. Take care, peace, and I'll see you again soon. Take care, everybody. Thanks for watching. Bye.